Hello and welcome. In this video we will show you the most effective way to help somebody put in a hearing aid with a standard mould and then how to take it out again. First, let's check that the hearing aid is working. The simplest way of doing this is by closing the battery door to turn it on. We'll wait for about 5 to 10 seconds for the hearing aid to turn on. Then, if it's working, it should make a noise. There we go. If the hearing aid doesn't make a noise, check if the tubing is blocked with wax. If it's clear, change the batteries and try again. If the hearing aid still doesn't work, then it may be faulty and will need to be returned to where it came from to be fixed. Now let's check we're putting the hearing aid in the correct ear. Now this is the right hand side hearing aid. How do I know? There is a red dot here. Blue means left, red means right. On most hearing aids you will find either red or blue somewhere on the hearing aid. Now, let's take a closer look at the ear mould. There are a few things to be aware of. We have the top spike which helps keep the ear mould in place. It fits into the flap at the top of the ear. It's very important to make sure the ear mould is fitting into this flap properly. I'll explain more later. Notice how the mould is a conical shape. Without the other part to help keep the ear mould in place, the action of your jaw when talking or eating would force the ear mould out of the ear. So let's get ready to put this into the ear. Communicate with the person to get consent before you start. With standard mould, we put the mould into the ear first. Start by making sure you're holding the hearing aid in the right way. It's best to hold the soft plastic tube with your finger and thumb. If you were to hold the ear mould, there's a chance your thumbnail will get in the way and possibly scratch the person's ear. Once you've got a good grip and you're holding the hearing aid the right way, we want to make sure that the ear mould is lined up properly. The inner part here needs to face the ear and the top part should be facing upwards. To double check you're putting this in the correct ear, make sure the back part lined up with the curve of the ear. If it doesn't, then there's a very real possibility you're attempting to put the ear mould for the right ear into the left ear or vice versa. As you move the ear mould closer to the ear, make sure it all lined up properly. If you twist the ear mould in any way, it will become more difficult to push in. So, push in and down slightly to get the ear mould in. Once the bottom part is in, the person you're helping should feel a kind of click. See how the back part is in properly. Now we need to make sure that the spike is in. Remember, leaving this bit sticking out will make the hearing aid whistle and can cause pain and discomfort for the person. So please be very careful about checking this is in properly. So let's push this bit in. If it's a tight fit, you can pull, gently mind you, on the upper part of the ear to create more space. This is particularly useful if the ear mould is a soft silicone model, as they have a great deal of grip. Once the ear mould is in, just run your finger or thumb over it just to make sure that it's seated properly. Finally, put the hearing aid behind the ear like so, close the battery door, turn it on. Now we do a quick test. Speak with the person to make sure they can hear you clearly. Now, let's look at taking the hearing aid out again. Now you might be thinking, why do we need a video on this? Well, let me demonstrate. Here I have a hearing aid in a silicone ear. What I've seen so many people do over the years is this. If I were to pull any harder, what do you think will happen? Yes, the tube will come out of the ear mould. Now we have a problem, as the tube will not go back into the ear mould. It will need a brand new tube fitted, otherwise it's going to whistle. If by some chance you manage to get the tube back in, this indicates that the tube was not a tight fit in the first place. It will be loose and it will whistle. It will also have left the ear mould inside the ear. So how can we take the hearing aid out of the ear without putting on the tube? Like most things, once you know, it's easy. Before you do anything, you must speak with the person so that they know you're about to take the hearing aid out. Never grab the hearing aid without consent. The first step to taking the hearing aid out is to turn it off. We do that by opening the battery door, then taking the hearing aid off the ear. That stops the hearing aid from making that awful feedback noise, which can be very uncomfortable for the person. The next step is to take the ear mould out. Using your finger, carefully push down on the outer part of their ear. This will help expose the curved back part of the ear mould. Carefully push your finger in, prizing the ear mould away from the person's ear. Once you've got a good grip, pull the ear mould backward and away from the ear without twisting. All done. Every night, once you've taken the hearing aid out, use an antiseptic wet wipe to give it a quick clean. This wipes away the build-up of wax on the mould along with any germs or bacteria, reducing the chances of ear infections. It's a good idea to have a box to store the hearing aid in to keep it safe and secure. Ideally, it be brightly coloured, but clearly marked with the person's name and whether it goes into the left or the right ear. So, that's how we get the hearing aid in and out of the ear. Thanks for listening.